You're listening to Radio Azad, and this is Coffee Connection with your host, Aisha. It's time for our health and wellness segment with Dr. Neelofer Basaria. And we are going to be talking a lot about diet and how they affect chronic conditions. Hello, how are you?
Good. How are you?
I'm doing. Let's put the mic a little closer.
Is it
Okay.
working?
Yeah, you can just pull it a little closer.
Okay.
All right. So, as you all know, Dr. Basaria is a health and wellness coach, and you can check out her website, drbasaria.com. She is on Instagram as Dr. Basaria, and she has a free masterclass that you can sign up for as well on her website. And you can also call her for a free consultation 469 645 8681, and you will be well on your way to looking great and glowing. So today we are going to be talking a little bit about how eating too much of a certain food or not eating enough of a certain food can actually raise the risk of dying from certain diseases, like we have heart disease, or we have you have your diabetes, or you have your strokes, or certain cancers as well. In fact, the 10 leading causes of death are now chronic diseases: heart disease, cancer, stroke, diabetes. Heart disease coming in at number one, cancer at number two, stroke at number five, and diabetes at number seven. In fact, two-thirds of US adults are overweight or obese. So you can see the link between obesity and these chronic conditions.
Mm-hmm. Yeah, those are staggering numbers,
Yes,
right?
and not getting any better, right?
Yeah, yeah. Because the lifestyle.
Lifestyle.
Yes.
All about lifestyle changes. So why don't we start off with the very basic question: what is the relationship between diet and chronic diseases?
All right. So, diet, your food. Your food is extremely important. So, what your food is, it's fuel to your body, right?
Mhm.
So, when you give the right fuel to your body will move towards health,
Mhm.
right? Food has function, it has its role. So, what its role is it's full of nutrients, right? That when you consume, your body uses that for production of energy, growth, sustenance of this body.
Mhm.
It's
Right.
maintaining its functions,
Mhm.
right? So food has a very important role. It has function in your body. Now if you use foods that are that have more inflammatory nutrients,
Mhm.
then your body will move towards disease. If it has nutrients that give you health, for example, some fruits and vegetables, apple, bananas, all right, that's one category of food,
Mm.
a lot of vegetables. The other is your pretzels and your chips
Your
and
processed
your,
foods.
yes, your candies,
Okay.
right? So both will go into your body and
Mm.
you will draw some amount of energy,
Mhm.
right? But the function that an apple will play or the banana will play is completely different than what that candy will do or that pretzel will do, right?
Mm.
So food is very important and it has a direct relationship with disease. The better
Okay.
food, you go towards health,
Mm.
less disease, right?
And that's why I think we see in developing countries, or where there is a food, where there's food insecurity, that's also where we find a lot of diseases.
Correct. Malnutrition, and then, if the availability of fresh food is not there
Hmm.
and you're consuming a lot of processed foods, then you will see um, chronic conditions. And this country is a prime example of
Hmm.
that.
Yeah.
We have so much processed food available here. And so you see the numbers of diabetes, and you just mentioned at the top of the program, right? Cancers,
Hmm.
heart disease.
Yep. Yep.
Yeah.
And that's all going up. So let's kind of break this down a little bit. So we know processed foods bad for you, right? Because of the linked with the obesity and all these other things. Let's specifically break down certain types of food. For example, red meat. Why is that so bad for us?
So, red meat is loaded with saturated fats,
Mm-hmm.
okay, and it has no fiber. So, mostly when you will see animal food, it is devoid of fiber, whereas plant food has a lot of fiber. And
Mm.
fiber is very good for your gut microbiome, the good bacteria that keep you healthy,
Mm-hmm.
right? So, any food that has loaded amounts of trans fat, saturated fats, they are not good for your body. Similarly, the other kinds of foods that are loaded with sugar,
Mm-hmm.
sugar is very inflammatory,
Mm-hmm.
right? It will mess up with your insulin, which is your metabolic hormone. It is really the king of the hormones, right?
Mm-hmm.
So something that is loaded with sugar,
Mm-hmm.
so be it your juices or your other drinks or your candies or your bakery products, right? White
Mm-hmm.
flour,
Mm-hmm.
all of those foods are bad. And then if your food is loaded with salt,
Mm.
so in all the processed foods, these are the three ingredients that are present in very high amounts:
Your trans fats,
trans fats,
your sugar,
saturated fats,
yeah,
your sugars, and sodium.
and sodium. Okay.
Yes.
Oh my goodness. What about dairy?
Well, dairy has its role and it evolves with age. So when you have a baby, all they survive on is dairy,
Mm-hmm.
right? And then as you gradually grow, a younger child, a teenager, you need strong bones, right? You need the muscle function, the bones function. You're growing. Your
Mm-hmm.
body is actually physically growing.
Mm-hmm.
So dairy is important there.
Okay.
Okay. And there are both kind of dairies, so plant dairy and animal dairy. So you don't have to solely rely on animal dairy. You can also consume plant dairy. But
Mm.
then as you age, you have less and less need of like full-fledged, dairy, animal dairy.
Mm-hmm.
But you do have your needs for calcium and potassium and magnesium.
Mm-hmm.
So those are important for your muscles and bones, for your body to function. But with age, comparatively, what is needed when you are young
Mm-hmm.
is not what is needed by your body when you are,
Mm.
say, 40, 50,
Mm-hmm.
60.
Mm-hmm. This is a very important point. So, when you're growing, like let's say as a child, elementary school, what are some of the things that parents need to really make sure that is incorporated in their child's diet versus a teenager versus, an adult and then as a senior? So, if you can just kind of briefly go through this.
So, well, just take basically the growth phase, which is like, from the time you are born until you are 14, 15. This is like active growth phase.
Mm-hmm.
So, it's going to be the same. And, some kids still develop until, at 16, 17, but then it tapers down, right?
Okay.
So the growth phase
Mm-hmm.
is where you should have, dairy, like we talked about, because calcium is needed. But then, this is also the time when you're developing habits. So
Mm-hmm.
if kids are, there are different ways to feed kids vegetables,
Mm-hmm.
right? Kids generally like fruit.
Yeah.
It's the vegetable, if it's early on, if they have developed the taste, they will not mind it.
Mm-hmm.
Okay. So, you know, as much as kids despise eating vegetables, if you start early on, it will be very good for parents who, later on struggle with it.
Mm.
And so your greens, broccoli, Brussels sprouts, all these excellent vegetables, spinach, kale, all right. And then going to then, what we talked about, good fats.
Mm-hmm.
So including nuts and seeds in their diet,
Mm-hmm.
right? Avocados, fish, all right, and lean proteins. because protein is also needed for muscle building. So this, and this is a time for habit forming as well. So I would go full on, fruits and vegetables, lean proteins, of course dairy, and then giving them a variety of grains. Right, so
Mm.
if they like rice, white rice, maybe you can, half and half it with brown rice and white rice, or you can add some quinoa so that they can have a different variety of grain.
Mm.
Or there are so many other grains that are available.
Mhm.
So legumes, those are all
Very good
very
for you.
good for you.
Mm.
So early on there's more need for all these things, but as you develop and if you form good habits, then as you're growing and you're into adulthood, you can continue those habits and have fiber. Fiber is most important, with respect to in the fat category, good fats,
Mm.
and then lean meats.
Mhm. Mhm. You mentioned something very interesting, and that is there are ways to build in those vegetables into your child's diet.
Hmm.
I've not been able to do that with one of mine. The other two, yes. How do you do that as a mother who struggles with, just incorporating vegetables into a child's diet, a young child's diet, let's say? What are some of the
Yeah, so
things
they
you'd
like
recommend?
if the child is more particular about the texture,
Hmm.
so then you soften it more, like to an extent that if you want to grind it, you can grind it,
Okay.
right? So you can do smoothies, you can do so, there are some vegetables that are hidden in that smoothie,
Mm.
or you can create ice creams from fruits,
Hmm.
or you can do, like if you're making your kebabs, you can just grind with everything, your vegetables. So I've done it many times for my kids.
Okay.
Where I
But
have
they're
my
not listening.
greens and my carrots, and they
Okay.
don't even know or they don't realize it,
Oh,
right? So anything where you can mush it up and you can grind it, or where you can hide it on the different things that you are making. Like even when you are making halim, you can make it with better ingredients. You can put your steel cut oats, or your cereal, your quinoa, or and you can try, you
mm.
can make quinoa biryani. But gradually, it's
Uh-huh.
it's a gradual step. So
Okay.
once you put some hidden stuff and they are developing the taste, then you can open it up more,
Okay.
right?
Mm-hmm.
So but the important thing is small steps, gradually, and give them their sweet, or whatever, like in their smoothies. Like I've added dates in my kids smoothies, so they like it because it
Mm.
gives that sweet
Okay.
taste,
Okay.
right? So you know your child, and you know their taste, and you know what kind of texture they like, and then
Mm.
based on that, improvise. And there are so many ideas
Right.
online. If you look, there are sites where those sites really help moms
Mm-hmm.
to create different kind of foods, right? So we
Interesting.
have technology
At our
at our,
fingertips.
yes. So make use of it, but trust me, we've all moms have tried different tricks, and some have worked for some kids, some have
Yeah.
worked for other kids, and so your kids better. But there's just so much available out there.
Yeah.
Try to incorporate this early on. It'll make your life so much easier later.
Absolutely. I think you normalize giving vegetables.
Yes.
So when they grow up, then they're okay with it. My husband is so funny because he's like, give full disclosure. If you've added spinach, you have to tell the kids. And I'm like,
Well,
no.
that is also yeah. So it depends on where your kids are, but a lot of times kids appreciate it when they
Mm.
make it
Mm.
with you. So
Yeah.
when they have put in the effort, when they have gone to grocery shop with you, when they are cooking with you,
Right.
because then their buy-in is there,
Yeah.
right? So a lot of kids benefit from that. So
Mm.
involve your kids with you
Yeah.
in
Absolutely.
cooking. And that's such a basic and but such an important skill that you can give to your child as they
Yes.
move out, right,
Mm-hmm. Mm-hmm.
to college. So
Absolutely. Absolutely. So when we're talking about diet and how it affects chronic conditions, does it matter as far as gender is concerned, I know socioeconomic status, yes, for sure, we've seen that. But does gender make a difference? Are women
Yes.
impacted differently than men?
Yes, it does. For certain diseases. So, for instance, heart disease is more common in men just because, their consumption of, say, alcohol or cigarette smoking or um, inactivity. If so, generally, um, men are more predisposed. Of course, first of all, your genetics plays a role. So if you
Hmm.
are genetically predisposed as a woman, you know,
Mm-hmm.
you are more likely to get it. But other than family history and genetic predisposition, your lifestyle habits. So generally, men are more prone to heart disease. Females have some benefit because of estrogen.
Mm-hmm.
So after menopause, then they catch up.
Mm.
With cancers, men are more um, toward prostate cancer or liver or lung cancer, again, lifestyle habits
Mm-hmm.
and their hormones. Female are more towards, breast cancer, uterine, cervical, ovarian cancer because of hormones.
Mm-hmm.
Osteoporosis is more common in women
Yeah.
because we already have, like, thin bones or, whatever your structure is. So, and especially after menopause,
Hmm.
you don't have the benefit of estrogen. So women are more predisposed to osteoporosis. Autoimmune conditions, um, women are more predisposed because the way women process stress
Mm-hmm.
is very different than men. So depression, anxiety, those kind of things, autoimmune conditions, women are more predisposed to,
Mm-hmm.
or commonly get.
Mm-hmm.
With men, it's more substance abuse, more suicide, those kind of things. So yes, there is gender bias or gender
Predisposition.
predisposition
Yeah.
to some of these chronic conditions. Yes.
Mm, mm. You also mentioned plant-based diet.
Hmm.
इसका क्या मतलब होता? If you can explain this.
So if you're eating more from plants,
Mm-hmm.
more vegetables, you are getting a lot of fiber in your
Okay.
diet.
Okay.
Okay.
And how much should be the recommended amount per
S-
day or?
Well, fiber as much as you can take is good. If you're looking at a label, um, you know, if it has 6, 7, 8 grams per serving, that's good,
Okay.
right? So where you get your fiber from? You get your fiber from, if you load your plate with vegetables and you eat some fruits,
Mm-hmm.
right? So that has fiber the way God has given us an apple
Mm-hmm.
or an orange or
Mm.
a banana, right? So that has fiber. So
Okay.
it has a lot of nutrients that has fiber. So that is your source if you are consuming vegetables.
Mm-hmm.
Then seeds and nuts have some,
Mm-hmm.
right? And then if you are eating multi-grain, like, if you're not processing your flours, right? So if you're making a bread and you're making it with very white flour, which is processed, then you have stripped away all the nutrients that,
Mm.
or the fiber that flour has. So you've completely made it where you will consume it and it'll convert into glucose in your body because all the processing has been done outside. Whereas if
See.
you eat some multi-grain bread, if you're eating quinoa, other grains, amaranth, there is jawar,
Bajra.
bajra,
Mm.
ragi, the different buckwheat,
Mm-hmm.
right? So those are where your body, your stomach is actually processing it, digesting it. So
Mm.
you get a lot of fiber through them, and that fiber will then feed your good gut bacteria.
I
So
see.
that is how. So plant-based diet has more fiber.
Mm-hmm.
Okay, your legumes, your lentils,
Dal,
right?
beans.
Yes, beans, chickpeas.
Mm.
These are all plant-based. So plant-based sources have a lot more fiber. With animal-based sources, which is chicken or mutton or beef or those have more fats. Now it depends on what kind of if you're using organic, if you're using grass fed, then the type of fats that the animal is producing in their body is good for you, so you will get more good fats.
Mhm.
But if you're buying from a regular shop, and you're consuming meat every single day, A, you're not getting fiber. B, you're loading yourself with saturated fats that the animal produced in their body because
Mhm.
they were not given the right feed, right? So
Hormones.
all of
Yeah.
that is then becoming a part of you.
Mhm.
So that's why mostly consuming animal diet is taking you toward heart disease, because it's going to load your body up with saturated fats. Whereas if you eat plant-based diets or Mediterranean diets, what they focus on is more fruits and vegetables, complex carbs, so
Mhm.
more grains,
Mhm.
right? And then olive oil, avocado. So the fats that are used there are good
Good.
fats,
I see.
right? So that is a diet that profile is that's something that you need to be consuming on a regular basis.
Mhm.
And then you can have meats, lean meats here and there, right? But the
Got it.
focus is more on plant-based.
Okay. How can something that's rich in fiber and rich in antioxidants, we keep hearing this buzzword, antioxidant,
Mhm.
that can help keep cancer away? Could you talk a little bit about that?
So, look, what happens in cancer? Cancer is, again, like all the other conditions, is inflammatory condition. So if your body has a lot of inflammation, you will go towards heart disease, diabetes, cancer. So in cancer, what's happening is your body is growing cells at an abnormal pace. And so the cells are dividing and redividing,
Mm-hmm.
right? And there's just so much cells, your body doesn't have space for it. And that's where you see the lump, right?
Mm.
It starts small and then it grows. So your antioxidants,
Mm-hmm.
what they do is they when the body is, when normal functions are happening, there are a lot of reactions that are happening in your body. You're using food to produce energy, right? In that process, there is some leftover. There are things that are just produced that don't have any function. These are free radicals.
Mm-hmm.
Okay, so something has to zap it and take it out from the body. If you don't take these free radicals out from our body, these are wastes, right?
Mm.
So in the process of energy production, the processes that are going on in your body, you do produce some waste. So what fiber does, it zaps it. What antioxidants do, it zaps those free radicals, and it removes it out from our body.
Okay.
All right. If these free radicals remain, then what they do is they go and tinker with our DNA. They
Mm.
mess up with our DNA, where they start forming some mutations, right? And then the cell start dividing and redividing, which normally it should not do.
Mm-hmm.
But since there is just this these free radicals have messed up the system, then cancer formation begins. So um, antioxidants will stop your free radicals. They also make your immune system very smart, so it can locate where cancer is forming and it can stop it.
Mm-hmm.
All right. So antioxidants are very important, and those
Mm.
are in your berries, in your vegetables, in your green leafies, in nuts and seeds.
Mm-hmm.
All right. And turmeric, ginger, they are also antioxidants. Your vitamin C.
Mm-hmm.
All right. So, very important to consume antioxidants to then stop the process of inflammation and disease in our body.
I see. I
And then
see.
fiber also, like I said, it will zap the free radicals, but it also, an important thing that it does in your gut is it is the food for your microorganisms, right?
Mm-hmm.
So
The good
when the
gut
good
bacteria.
gut bacteria,
Okay.
right? So when your good gut bacteria are healthy, they produce something which is called as these are fatty acids that are very, butyrate is one.
Mm-hmm.
They're short chain fatty acids.
Okay.
Those are very important. Those are anti-inflammatory, and they will stop the process of cancer in your body. That's why fiber is good for heart disease, but it's very good for cancer as well, right?
Mm.
Because you are making your gut strong, and from there, there are chemicals that are released in your body that are anti-inflammatory.
Mm-hmm.
So although you didn't eat something, but you ate foods which were fiber loaded, and then the anti-inflammatory process started in your body. You see?
Got it. But can you actually, I know you talked about stopping the growth of these cancer cells. Can you actually reverse it by changing your diet? Not only cancer, but other chronic conditions.
Yes, you do. So, and I have clients who have done that. So basically, cancer thrives on sugar, right? So now, we just talked about fiber. So fiber and sugar have opposite functions,
Mm.
right? Sugar is more inflammatory, fiber is anti-inflammatory.
Mm-hmm.
So if you remove sugar from your diet, you're regressing. You're not giving any food to those cells to survive.
Mm-hmm.
Okay. So, well, in some cases where you have progressed quite a bit, you really have to be very strict with sugar, and you can reverse your condition. Same with heart disease.
Mm-hmm.
So if you are eating high fiber diet, you are going to change the way your body is producing fat. Your liver also produce fats,
Mm-hmm.
right?
Mm-hmm.
So your triglycerides are being
Yeah.
produced in your liver. Your fat is taken from one place to another through these small molecules, the HDL and LDL,
Mm-hmm.
right? So if you have HDL, then you're more heart healthy. And if you have more LDL, then and then there are other particles, right? So I'm not going into the details there, because then you will get confused. But those are not good way to channel
Mm.
cholesterol in your body, right? So
Okay.
then they produce inflammation and they get stuck in your heart vessels.
Mm-hmm.
So fiber also helps you with blood pressure. It actually dilates your blood vessels. So you see, if you're
Oh.
having problem of high blood pressure, having fiber, you are dilating your blood vessels.
Mm-hmm.
Yeah, you're helping it there. You are changing the production of some fatty acids in your body, triglycerides in your body.
Mm.
You're actually changing the transport of that of cholesterol in your body. So there are a lot of things that by eating right food, you are changing these processes in your body. And so you actually reverse by eating a lot of fiber and keeping an eye on your sugar. You're going to change insulin resistance in your body and thus diabetes.
Hmm.
So all of these initially will stop inflammation in your body, and through that, then the other processes will get enhanced, which are more heart healthy, metabolically healthy, healthy for your bones, your muscles. So then you actually change the process, the direction that you were going with bad food. But with right foods, you can change that direction, and
How
that's
long
how
does
you
it take?
regress.
Sorry, how long does it take to change that direction? I know each person is different, but people want like quick fixes. So
Mm.
let's say you give up sugar, right? I mean, or you give up a high fatty, or you give up red meat, or whatever. How long does it take to actually you for you to start feeling these results?
Okay, so just like how disease develop over time,
Mm.
right? So if you're eating wrong foods on that day, you will not have a heart attack, right? But it's
Yeah.
developing over time, and then you see a manifestation of
Mm.
disease, right?
Mm-hmm.
Similarly, the day you will stop eating a lot of sugar, or you will start taking care of your foods, you will start getting better. But the manifestation comes differently for different people, and it
Mm-hmm.
depends on how disciplined you are as well,
Mm.
right? So people have started changing their things, where in my program, when I work with people, within 8 to 12 weeks, they start seeing, like, we do a blood report, and then 3 months after, when we do a blood report, they see
The
their numbers
difference.
changing.
Mm-hmm.
So the process starts inside the day you start,
Mm.
right? And then gradually you see improvements, and you get to an extent where you can reverse cancer, and you can reverse diabetes and high blood pressure, heart disease, all of that.
Mm-hmm. Interesting. Okay. We also hear, along with antioxidants, we hear that foods rich in omega 3. are very good for you, right? What are some of these, and how can they help protect our heart?
Yeah, so omega 3s are your good fats. So, uh, see, there has to be a balance of omega 3 to omega 6. Omega 6 are coming from your oils that
Ah,
you use, your cooking oils, right?
okay.
So, the way we consume food right now in America, this ratio has tipped from 1 to 1 to 1 to 25. Means 25
Wow.
times we are taking omega 6 and just one
Mm.
omega 3, right? So this is not a good ratio. We have
Mm-hmm.
to go back to 1 to 1.
Okay.
And so, which means that we have to reduce our consumption of all these fried foods and,
Mm.
fatty foods and, oil that we use a lot in cooking, but be it frying or in general cooking. So, using better oils like olive oil, avocado oil, and organic forms of oils if we can, and in small quantities, because generally oil get through processing, so it is stripped away from nutrients, so we don't need it a lot, right? But then improving our omega 3s, right? So if you raise that up, then we get to 1 to 1 ratio,
Mm-hmm.
right? So omega 3s are basically anti-inflammatory fats.
Okay.
Okay, so there is ALA, EPA, DHA. So there are three forms, and they will start the process of stop the process of inflammation. Okay, in your body. So that means they are taking you toward health. So they are good for your heart and they're good for your brain.
Mm.
So these are the two important things that you need, right,
Okay.
to function. So good for your heart, like I said, and if your body has less inflammation, you will move less towards heart disease. Your vessels are not constricted; they're not filled with inflammation and fats, right? So your blood will flow properly.
Mm.
So they will help you with your heart, your blood pressure, right? Um, then they are good for your brain. So they're anticoagulants. So basically, if your blood is not clotting, you will not have strokes. Stroke is, when
Yeah.
your blood clots in your brain,
Mm-hmm.
right?
Mm-hmm.
So they're anticoagulants.
Okay.
And then they improve brain function. So if your cognition is better, your brain function is better, then that will help with, and the flow of blood is better in your brain.
Mm-hmm.
Omega 3s help you with that.
And what are some examples of that?
So you find omega 3s in fatty fish.
Mm-hmm.
So your salmon, your
Salmon.
sardines, your mackerels, your herring, your trout, right? So if you can eat fish twice a week,
Mm-hmm.
right? Twice in a week, just have that habit. Then you go to your nuts and seeds.
Mm.
Your nuts and seeds have omega 3s. So your flax seeds, your chia seeds,
Mm.
they have omega 3s. Your walnuts,
Okay.
okay. So those are your other sources. Your nuts and seeds are very good, and they are like your avocado, good
Mm.
fats,
What
right?
about shrimp?
Well, yes, to an extent, but it has more cholesterol as well.
Okay.
But shrimp is a good source of protein,
Mm-hmm.
you know. But more those fatty fish that I talked about, they will give you more benefits. And flaxseed oil, fish oil,
Mm-hmm.
those
Mm-hmm.
are good sources. Yeah.
Okay. 972-501-9390 is the studio number. If you have any questions for Dr. Neelofer Basaria, as you know, she's a health and wellness coach. You can check out her website, drbasaria.com, Basaria. And she's also on Instagram as Dr. Basaria. And you can call her to schedule a free consultation. 469-645-8681 is her number, and you can sign up for her free masterclass as well on her website. All right, let's take our caller. Radio Azad, you're on the air.
अस्सलाम वालेकुम आयशा एंड डॉक्टर
Walaikum assalam. जी अर्जुन.
कैसे हैं आप?
Good.
बस मैं तो कुछ सवाल तो नहीं है लेकिन जस्ट अटेंडेंस लगवाना चाह रही थी कि सुन रही हूँ
Mm-hmm. अच्छा.
जस्ट लिसनिंग टू यू यू नो
Okay.
आप
Okay.
आती हैं
Thank you
अच्छे
for
अच्छे डॉक्टर
listening.
साहब आती हैं इतनी दूर से अपना टाइम खर्च करके तो
Okay.
जस्ट वांट टू लेट हर नो दैट आई विल लिसन
Thank you so much. Thank you. I know she gives out very, very good information. 972-501-9390. If you have a question for Dr. Neelofer Basaria, then you can call in and ask her. And we also will tell our listeners that we're also going to be doing a series on each um, chronic condition. So we'll talk about diet and diabetes, we'll talk about diet and cancer, we'll talk about, all these heart disease, so many different aspects of these chronic conditions in the months to come. Okay. Um, Osteoporosis. We touched a little bit upon menopause and how estrogen, protects us. But then once that estrogen goes down, then, we find that heart disease emerges and, of course, broken bones and all this kind of stuff. What should women who are perimenopausal or postmenopausal, what are some of the things that they can eat? But we have a caller, so let's take them on the air. Radio Azad, you're on the air.
Yes, I'm enjoying the show because it's very, very informative. Thank you, doctor. And Basaria. And I just wanted to know, you say when your body is inflamed, you get pains and all that. Do these painkillers help in reducing the inflammation in the body, and does it help in reducing the various diseases also if you take painkillers? Does it help your inflamed cells?
Okay, that's a good question. We will
Yes.
hang up so you can listen. Let's take our other caller and get their question as well. Radio Azad, you're on the air.
Hi, Ashishi. Good morning.
Good morning.
I've been tuning into your show, Dr. Basaria's show. Susalia speaking. Thank you so much for all the informative things that you are sharing. I also did a deep dive into the benefits of fiber a very long time ago, and I got to know even more benefits that fiber has. So thank you for educating us even more. My question to Dr. Basaria is, what I wanted to know what things that someone can consume to have a balanced to balance their hormones as females, because that's something that I struggle with, and I think many women struggle with. So maybe you could try to shed some light on that.
Okay. All right. Very good question. Thank you so much. 972-501-9390 is the studio number. If you have our Radio Azad app, which you really should, you can hit that call studio button, and no numbers to remember. Even if you're driving, you just hit that button and it will connect you to our studio. So two very, very good questions. One is about painkillers and whether they just provide symptomatic relief or do they actually help in lowering the inflammation in our body.
So basically, if you're taking over-the-counter medications for pain relief, it will do its work for the time being, right? So in that instant, if there is an acute inflammation going on, you can lower it by taking that, right? But for long term, if inflammation is going on, then taking these medications for a long time, like you're popping an Advil every day, I would not suggest. So that means then you will have to take more dietary approach, lifestyle approach, and change things there to reduce inflammation in your body. So we would say for the time being, but not a permanent solution.
Right. And I think we'll do a part 2 of this where you will actually address this whole, we'll delve a little deeper, go into how diet and inflammation and chronic conditions are related.
Yes, absolutely. The second question, where she talked about balancing
Hormones.
our hormones.
Yeah.
Yes. So just understand, with respect to hormones, these hormones that are female, especially female hormones, are affected by insulin and how stress works in our body. Okay. So insulin is affected by your fiber. Okay. So like we talked about, if you are taking a lot of fruits and vegetables, if you're staying away from naked sugars, all right, if your drinks are more, water based as opposed to sugar loaded drinks, right? So you're consuming more fruits and vegetables and adding that into your drinks. So you're staying away from sugar, leaning more towards fiber and good fats. So your hormones are actually made from fats in your body. So consuming good fats. So like we were talking about, your flax seeds are
Okay.
going to be very useful for your estrogen production. All right. So your fat seeds, your chia seeds, your walnuts. So consuming good fats will also help with your hormones. We just have to balance insulin function so that then that will, down the line, it just helps us with our female hormones. Right. The other major thing is how you process stress in your body. And if you are having a very stressful job, if you are having stress in your relationships, that will down the line affect your hormones. All right. So your hormones, fluctuation in your hormones, affects your stress, right? So how you feel on a daily basis and how your day-to-day chronic stresses your life is will affect your hormone.
Okay.
So address it with both your eating habits as well as your lifestyle. So whether you are sleeping or if you have a late nighter every night, whether you are taking some time for exercising to curb your stress, right? So all those will then impact your hormones.
Got
So
it.
keep an eye on both.
Okay. What about soy?
Yes, the soy can have both the effects. It can mess up with your hormones or it can do good. So the type of soy is also very important. If you are consuming organic soy, so like, say for instance, if you're consuming tofu and it's a pure form, it does not have impurities, it is organic, then that can help some people. It depends on your body and how it's processing soy. Soy has also shown in studies, it has shown an effect with breast cancer, right? So actually reducing the incidence of breast cancer. So depends on your source. Very, very important. I pay close attention to that when I consume soy. And then seeing how it is affecting your body, how your cycles are changing, what is how you feel in your body. So every body process it differently.
And then going back to my question about osteoporosis. So,
Yes. So osteoporosis, of course, as you will age, it is weakening of your bones, right? That's the disease. And it is basically as you age, and especially when you hit menopause, that's when the estrogen effect goes down and you start seeing, because women also already have thin bones, so we see osteoporosis more in women, right? And especially after menopause, we see more of it. So having like your bone density tests done will really give you an eye into, okay, how am I doing? Because over time, your the minerals in your bone are going down. So that's where the bone density will go down, and that is showing you that you're moving toward osteoporosis.
okay.
Now, what can be done about that? Again, um, your your food has a big impact on that. So are you consuming fiber? Are you the main minerals for bone health are vitamin D, okay, and then your magnesium. I love these two nutrients.
Magnesium. Okay.
Yeah, magnesium is very important, and then your omega 3s are important, right? So make sure that your calcium and vitamin D go together. So if you want to improve the absorption of calcium in your bones, then you need to take vitamin D. And all women, we all are so deficient in vitamin D because we don't go out in the sun as much. We are inside, indoors a lot. So those are important minerals: your calcium, your vitamin D, and your magnesium. And of course, omega 3s I talked about. They're anti-inflammatory, so they will help you there. But go heavy on your vegetables because they have all these nutrients,
Okay.
right? And if you don't go out in the sun a lot, then I would highly recommend to take vitamin D supplements.
Excellent. Such good information, Neelofer. I think it's definitely something that we can all learn from. As you know, Dr. Neelofer Basaria is a health and wellness coach, and you can find her at drbasaria.com. You can find her on Instagram as well. You can call her for a free consultation, 469-645-8681. And you can sign up for her free masterclass as well. And then she has some targeted 3 month courses as well that she has put together for especially for our Radio Azad listeners, I think, who can really truly benefit from the wonderful work that she is doing. Thank you so much. Anything else you'd like to add?
No, I would just say, if you are getting awareness, the important thing is to not only be aware, but take action. So take some small steps, whatever you learn from here, see what I can apply in my day to day life. Anything small is also good. Like there is nothing which will not give you benefit. So start small and then move forward gradually, and you'll be able to change a lot of things for yourself.
Yeah, it's not enough just to listen or to just watch, like watch yoga classes and then the weight is not going to come off.
Yes, or you're not going to
That's
move towards away from disease, or
yeah.
progress in your health. So actually, when you listen, just think of one or two things that, okay, this is easy, I can take action here, and this is what my plan is.
That's a great tip. And if you break things up into small bite sized pieces, you can definitely get to your goals. Wonderful segment. Thank you so much. And looking forward to